Mark Davis, President and CEO of the PA Advocacy and Resources for Autism and Intellectual Disability. Tell us what your group does.
We're a professional trade association, and so our members are providers who work with people who have intellectual or developmental disabilities or autism, so folks with, say, Down syndrome or folks with autism. And we represent our providers' interest at the state and federal level. So we try to do everything we can to ensure that people with intellectual disabilities or autism are able to lead full and meaningful lives in the community through the use of our help.
Now tell me more about your providers and the services they render.
Okay, we've got about 150 provider members, and we've got about another 100 other members. So we've got close to 250 folks that either belong to our association. And they are people who provide services in virtually every county in the state.
What do they do, Mark? Give me some examples.
Sure. They basically work with people with disabilities, intellectual developmental disabilities, to they just have a broad array of tasks. So they do everything from helping people with daily hygiene tasks like getting up in the morning, getting dressed, going to the restroom, bathing, brushing their teeth, eating, with nutrition, any specific nutritional needs. They may need, for example, to puree somebody's food who has issues with swallowing, has a swallowing disorder. They have to be very specific in the way they do serve folks. They also do everything then also in terms of like administer medications. So they'll give a subcutaneous insulin injections, and they'll also administer medical equipment, maybe as simple as a CPAP, to help them with sleep apnea, or they may do other things in terms of like a G or a J tube to administer food or medicine through a G or a J tube like you would in an acute care hospital. They perform the roles of everything from a teacher to an educator to a counselor to a nurse to an employment specialist to help people get jobs in the community, to help people to access the community in the way that they want to access the community. So they may help them to connect with their community of faith, may help them to connect with volunteer opportunities where they can perhaps meet friends who don't have disabilities. We really think our role is, in that regard, is to help them to have friends who aren't paid to be their friends. To get where they want to go when they want to get there, to be able to actively enjoy living in their community and being a part of life, and to be lead the kind of lives that they can best lead.
So it sounds like your providers have to have a broad array of skills, and so that makes me think about what kind of experience and even formal training do they bring to positions like this in general? Yes.
In general, our providers have a broad array of training that is required by the state before they can work with people, and there are things around like client rights, there are things around how to report incidents if they happen to something untoward happens, something that we don't want.
Does that mean that they have to take a test?
Yes, they have some competency-based trainings. There's also it's voluntary, but they also have certification where they do the competency-based tests, so they can do national certification. Our state is moving towards a system where that's going to mean more. Right now, it means something to the individual, to the direct support professional. We call them DSPs, or direct support professional, doing the work, but it doesn't mean anything in terms of additional compensation or additional status. But we are moving towards that system, so that'll be happening pretty soon. So we're moving to kind of codify that. We also have the most important, though, Larry, the most important training that an individual has is specific to the individual they're working with. So they may be working with 1, 2, 3, or 4 or more individuals. Usually it's 1 to 3, but sometimes it's more. And so they need to know your specific assessment results, what your needs are, and how often those needs are to be addressed, how they are to be addressed.
Because people are different.
Everybody's different, and the services that we provide may be as simple as helping to balance a checkbook, but they also could be life-sustaining in terms of medication that is necessary for ongoing survival. So we have a real broad array. We have folks that are quite can walk and ambulatory. You see them in the grocery store. they work there, they're working in the grocery store, they're working in the community. You don't really notice the disability as much. Then you have other folks that are non-ambulatory, they can't walk, they need help with everything from going from toileting to eating to everything.
Right.
So we have a really broad array of folks that they work with. And one person may work with multiple people that have different arrays of needs.
Mm-hmm. Now, when intellectual disability services are provided, try to give me some insight, Mark, into how much value that represents for the families who otherwise would have to step in and provide that care themselves.
Tremendous value, Larry, tremendous value. And unfortunately, what we've seen lately is an 11% reduction in the service capacity of our system because of COVID and because of low wages. So we've had really a shrinking of that ability. So what we've seen, unfortunately, I'll give you an example. We got a call from and I actually met him. We got a call from a gentleman who was in his 60s, and his adult son was living with him who had a seizure disorder. And then we also had, and he and his wife were taking care of their son because they couldn't get services because they couldn't find a waiver because they're not paying people enough to take the job. So we have a real significant workforce crisis. And what happened was, God bless him, but his wife got stage 4 cancer. And so he called.
This family has their hands full.
Yeah, and he's saying, I am struggling with, I'm struggling with, there are times when, I mean, you hate to even say it, but it's reality, that he said I had to decide whether I address my wife's needs, who was in a high degree of pain, or my son, who was having a seizure. And people should not have to live that way. So we can provide that kind of assistance so that family members can go to work, can have a life outside of this. But a lot of families now are really taking on the responsibility for working with adult children who have disabilities because there is no workforce available, there are no services available for them, and we really need to do something to correct that.
Now, that situation you just described, Mark, given those circumstances, does that family get any kind of status of preferential treatment given the conditions they're dealing with?
Yeah, what happened, Larry, that's a good question. What happened was we got involved, actively involved, and contacted the state and other folks, and they were able to get a waiver, which is basically a funding mechanism that you can. It's kind of like a purchase order.
What is it you're waiving exactly? That's what confuses me.
Yeah, it is. Medicaid is a federal-state partnership that the feds basically make most of the rules, and then the state makes the rules according to the federal rules, and the feds pay us about 55% of the bill, and we pay about 45%. And what the federal law says is that people with disabilities, intellectual disabilities, have an entitlement to an institutional level of care. So to a state-operated center or to an intermediate care facility, kind of like an institutional level of care. And so what a waiver does is a person says, I waive my right to that institutional care, and instead I'll take care in the community. I want to stay living at home. I want to live in a group home. I want to live with less people. And I don't have, sometimes those folks don't have the significant medical needs. Sometimes they do. We've gotten quite adept at serving people some very significant, like everybody does, right, with medical needs in the community, and so they can waive their right to the institutional level of care. It's a little confusing, but that's what it is.
No, that helps me a lot. Now, how well is Pennsylvania meeting the demand overall for services? And of course, you mentioned a few minutes ago there's a workforce crisis, and low wages, of course, can help.
Right. Low wages are creating, like I mentioned earlier, 11% constriction, reduction in the service capacity of our system, which is difficult to even swallow at all. I've been in this industry. I started working with people with disabilities in 1974. And I was 14 years old, a water safety.
What do you know, the age of 14?
Yes. Yeah, I was a water safety instructor. My mother was running the Girl Scout camp because she was a volunteer. She was the head of the Girl Scout Lake to River Council. And she asked me if I would help kids with disabilities learn how to swim. And I said yes. So early on, and the first person I saw, I put him in the pool. He had cerebral palsy and developmental disabilities. And I put him in the pool, said, can you swim? He said, a little bit. So I put him in the pool, and he's kind of flailing about. And I'm going, that's good, Tony, good, Tony.
Yeah.
And the guy running the camp came right over, jumped in the pool, grabbed him out, and said, he's drowning, you idiot. No one had told me. So I felt awful.
Yeah, of course.
I jumped into the pool. I looked at him, and I just felt terrible. And I said, do you want to drown me? And he went, and then he put his hand on my head, and I flailed about too, and then we got along just brilliantly.
Yeah, I see that was the beginning of a nice relationship at that moment.
Oh, it was awesome. So once you get people with intellectual disabilities in your heart and in your blood, you'll never get them out. You'll never get them out. They are truly just beautiful, beautiful people. And so when we're faced with this issue of not having enough direct support professionals, it's not because they don't want to work with people with disabilities. It's in their blood. It's because we've had direct support professionals that have been living in their cars, that can't make the rent, that come in and say, look, I want my son or daughter to be able to go to college. There's no way I'm going to be. 23 years of a career, just said, I can't do it anymore. I've got to go work at a big box store or somewhere because I can make more money there. And it's really, and they're crying. I've had them in my office crying because they can't continue in the profession. We currently have 13, as of November 30th of last year, last data we have a total of 13,247 people waiting for services. And of those, almost 6,000, one person short, 5,999, that are on the emergency waiting list, which means they have an urgent need. So you asked me about that couple, right?
Yeah.
And they certainly have an urgent need.
That's the way it looks to me, yeah.
But there's 5,999 other people who have an urgent need, meaning they need some help now. So it's really is a tragic situation. And even if we have the waivers, what we found is we've got this waiting list, right? That's the formal waiting list. And then we've got this, what we call kind of a hidden waiting list, where you've got the purchase order, right? You've got the waiver slot. You've got the ability to go get it. You've got the authority and the funding. You can't find staff. So now you're sitting there with you've got your hopes fulfilled. I've been waiting a year, 2 years, 3 years, 4 years for this. Now I've got it. Thank God I've got it now. And then you go to get help, and the agency says, we can't help you. We don't have enough staff. We don't have enough staff to take care of who we have now. We're running 16, 17% of our payroll costs overtime. We just can't do it. So we're pleased with the direction the state is talking about going.
Now, if Governor Shapiro happens to be watching this interview at this moment, what kind of advice would you give him on recruiting the people you need? What kind of efforts can be made? And I'm sure you have some insight into that.
A little bit. And I have talked with Governor Shapiro about that more than once. And he has been very open about it and said that he would work with us, and it appears that he is. And he is. So I think it's I don't think it's as simple as, I think it's a multi-pronged approach. It's not something that we can just say, oh, it's this or that. It's a combination of things, but I can give you the big ones, right?
Multiple prongs.
Yes, multiple prongs, exactly. The big one is wages. That's the biggest one. We can't expect people for $16.83 an hour when you look at their tasks that they do. We did this with the Administration for Community Living, and we found out that the average was over it should have been over $22, almost $23 an hour, and they're getting paid $16, $17. It's just not, it doesn't add up.
How do wages in adjacent states compare? Just occurred to me.
We are lower. Ohio just bumped up their wages by 30% because they had the same situation, right? And then another 8% the next year, so 38% total.
A boost by 1/3 sounds significant.
Yes, it is, and it's going to help them out. In Maryland, they're paid better than we are, and in New York as well. I mean, so most of the states that surround us pay us, but some don't. West Virginia, for example, but most pay better than we do and have more luck with getting folks. Some of this is pretty new, though, because we've been kind of hanging on by a thread for a while, and now it's just gotten to the point where parents say, enough already. And it's been a lot of families really giving voice to this concern that I've got a waiver, and I got this funding mechanism, and I can't get the help that I need. That's just not right. Or people were getting help. We've had family members who have had that 11% rate reduction. Those are real people. Those are over 4,000 people that were in our services that are no longer getting services that they used to get because we don't have staff. So it's a significant issue. So what Governor Shapiro is doing is he's proposing.
He called for a systemic fix. What do you take away from that remark?
Yes, I think he's hitting the top two areas. I think workforce and waiting list are inextricable. You can't take those two apart. I think that the being able to serve people, giving them what they need when they need it, is really important. Or else families continue to suffer, and our economy suffers, frankly, too. And it's not the way to treat people. And secondly is workforce. Unless we have the available workforce to provide these services and they're paid commensurate with their experience, their education, and what their role is in society, then we're not going to be able to serve people. So he really is going after both. He's putting in some additional waiver funding opportunities, slots they call them, which is a terrible word, but that's just the word we've got. And then the other one is he's proposing to pay our staff more, which would equal about $2 an hour wages, which may not seem like a lot, but to direct support professionals, it not only is...
So $2 an hour increase helps a lot.
It helps a lot, and it also tells them that they're something they don't feel a lot, Larry, is valued. People just don't talk about them a lot. When you've gotten frozen rates for year after year after year and you don't get any pay increases or minimal pay increases, it's easy to start saying maybe what I do doesn't matter. Even though I know in my heart it matters, right? I see the results in the smiles and in people staying healthy and getting jobs and having relationships, getting married, having friends, being able to balance a checkbook, graduating from high school. Even though I see that, I feel it here, I don't feel valued. And so we have to do that. We also need some, I think it's not always how much money you have, sometimes it's how you spend it. And I think it's also about...
They talk about in state government all the time.
Yes,
that just a lot of funding isn't necessarily the answer. There's more to it.
And I agree with that. I think that we need more funding. I said that's number one, right?
Right.
So I'm not
and the governor's proposing an additional 12% for you this year, is my understanding.
Yes. 12% on the waiver side. So that would be for direct support professionals. Again, it would equate to about a $2 increase, $2 an hour increase. And that's not insignificant. So, and we're hoping we can make it be more. It just depends on how efficient we get with the dollars.
And can we translate that 12% increase into a shorter waiting list? Is it possible to make that connection?
Yes, absolutely. There's no question in our minds that the limited access, the challenges with access to services right now, the waiting list and the hidden waiting list that we talked about, both of those are directly in proportion to the ability to have a qualified workforce to meet the needs of those people. So there's, you can have people that get waivers, but unless you have the workforce in order to meet their needs, why would you give them, you know what I'm saying? I mean, it just doesn't make sense. Yeah, it's like giving somebody it's being disingenuous almost with people. It's telling them we're going to help you. Thank your lucky stars, you got it now. And oh well, sorry. No workers. We can't help you. So they're inextricable, I think.
Whenever we do a show about intellectual disabilities, the subject of the waiting list is inevitable. So I'll ask this question. Is it a reasonable goal to eliminate the waiting list for services? Are you able to be optimistic about that? Can you project?
I think that
realistic.
Well, what the governor's called for is a multi-year approach.
I don't mean immediately either.
Yeah, he's saying multi-year because I think that if he would have said I'm going to eliminate it in 6 months, I'd say
sounds impossible.
I don't know what you're thinking, but it's not clear.
Right.
But he's not said that. He's looking at kind of taking a bite at a time, right? So, and I think that's a wise approach. Do I think that we'll ever eliminate the waiting list? No, I don't. I think we will eliminate I have great hope that we will eliminate that 5,999 that are on the emergency waiting list. That is critical. That's like calling 911 and they say, "Can you hold?"
Right. You don't want to hear that.
I got a gun in my mouth. Can you hold on a minute? Just put it down for a second, all right?
Right.
It's not the way that we want society to operate. So we've got, and I believe that is a laudable and a practical goal if done over time and if done coupled with wage increases for staff so we can get more staff in, then I think it is a practical and a reasonable expectation.
I want to talk more about the name of your group, Mark, because after all, it not only has intellectual disability in it, but it also has autism in it. And that made me look into the governor's budget a little deeper. And I understand there's about $2 million for what was referred to as autism intervention. So that word intervention interested me. What is the significance of intervening?
What we find with particularly, I'll talk about children, right? With children with autism, is that the ability to intervene in a structured way as early as possible, typically before the age of 7, is critical.
So things don't get worse.
It's, right. Actually, the opposite, so that things get better. You know what I mean? I mean, yes, things will not get better if you don't do that.
Right. You intervene for the purpose of making it better.
Making it better, exactly. So well put. So we know that the studies have shown, there's no question, the studies have shown that if you intervene with specific services.
Yeah, what do you do? Can you give me some examples of those services?
Usually, it's a lot of it's like applied behavioral strategies. So it's using structure and
structure applied to what, Mark?
Teaching them to folks with autism have challenges interacting with other people, for example, right?
Understood.
And communication challenges. This is a way of saying, of reframing their relationship with others in a way that they can understand, that they benefit from. So they start to see that, you know, if I don't scream and throw things at people, then they're more likely to give me what I want. If I throw and scream people, I just get in more and more trouble, and I go down this rabbit hole where I never come out of. So it's a way of reframing that in a way that they can understand. And I'm really oversimplifying it, but that's really what it is. It's really trying to restructure the way they interact with the world, and you know. And
there's something to be gained from positive reinforcement. It's what I'm hearing.
Absolutely, and absolutely. Yeah. And you know, they tend to be, you know, have the obsessive tendencies where things have to be in a specific order, and then get very agitated when they're not. And there are techniques for helping them to deal with that. You know, to say that it's not the end of the world if your socks aren't in color coded. To them it is, and I understand that. We all have right? We all have something that just, God, I can't. For me, it's the cap off the toothpaste. I don't know about you. But like, if there's a cap off the toothpaste,
I might share that.
You know, just like, oh, put it on the tooth.
Put it on.
Put it on there. It drives me crazy. But and there are certain things that
would it kill you to clean the top of the toothpaste too?
Exactly. So I think we all have those things, idiosyncrasies. Well, the challenge with folks with autism is they're more pronounced. They're a little bit louder. And they hang on to it a little longer. So you're able to talk to them. I have worked with people who have gone through these services, right, the applied behavioral techniques, and it is a beautiful, beautiful thing. I mean, I've gotten hugs from people that I almost cry when I'm hugging them because they're so excited. They come, and people with autism aren't going to hug you, you know, a lot of times, and it's just
because they're not wired that way. You don't expect it.
They're just not. Yeah, and it's really a beautiful thing how far we've come in terms of autism services, and specifically early intervention services. Before the age of 7 is critical, and some people will say before the age of 12. Some will say 5. I'm like, the research I read, it's 7, but it's somewhere between 5 to 7, and you got to start by then, and then you can continue to make progress. And the amount of people that actually do have significant improvement in the way they relate to the world and relate to others and themselves is pretty incredible.
Here's something else. I was looking at Governor Shapiro's budget proposal for intellectual disabilities, and it has to do with $1 million, which maybe on the surface doesn't sound like a lot of money, but it interested me because it's for sign language and English interpreters. So it occurred to me just how often are communication barriers a problem in the intellectual disability community.
That is a significant. It's a significant issue when it's an issue. I wonder how often it comes up. It's not commonplace. I'd have to look at the statistics. Sure. It's not commonplace, but when it is an issue, it's something that needs to be dealt with. So we are really happy, really pleased with the, and it was 999, you know, almost $1 million.
I rounded up to $1 million.
You're right. We'll go for $1 million. We had a lobby for that, but then, but it also is matched by the federal dollars. Remember, they pay 55%, we pay 45%. So if our 45% is $1 million, it's well over another $1 million that matches that. So it's over $2 million in the total budget.
So it sounds like the federal government is pulling their weight, the majority of your funding. Talk more about that and how much you count on that.
Our number one partner in this, for us at least, is people with disabilities, family members, counties, state folks, and the federal government. Federal government tends to take a large policy look at this. So they'll set the rules up here, like access, free choice of provider. They'll have these large kind of policies that are to some extent not particularly well defined in regulation. But what they do is they allow states to come up with how do they then comply with those regulations that are at a higher level. So the feds, our relationship with the feds, the federal government, is extremely important because they set the top level policy for the entire program, for Medicaid, let alone for what we do. You know, we're kind of here and Medicaid's here. So we rely on them quite a bit. I was just on a call before I came here about the federal access rule, and they're coming up with a new rule that says, how do we ensure access? Because the federal law says that provider rates will be sufficient to ensure access to services at the same level that they're, I'm paraphrasing, the same level that they're available in your community. Part of the challenge for us, as you can imagine, we don't have IDA, we call it, intellectual disability autism. We don't have IDA services that are paid by UPMC or United Healthcare. They're just not in an employer's health plan other than autism. Sometimes they are included for autism. But a group home or a living in your apartment getting supported living in a home is not included in that. So
Now, let's consider that the governor's budget proposal is just that, a proposal, and it needs the approval of lawmakers. And since you're in the advocacy game anyway, I'm guessing you have some insight into who the champions in the legislature can be. In other words, do you anticipate any resistance what the governor is proposing?
I think always. I think that you have to anticipate resistance. I do not anticipate any resistance on the worthwhile nature of the investment. Every legislator I've spoken to, and I've spoken with a lot of them, has told me that this is greatly needed. It just comes down to can they afford to do it. And I respect that because that's their job to set the parameters of our budget, right? They hold the purse string, so to speak. But so I don't think on a policy level we're going to have much debate about it. I think the policy, if there's any debate about it, the debate will be about can we afford to do it? Is it, do we have the money in the budget to be able to do it?
Mark Davis, President and CEO of the PA Advocacy and Resources for Autism and Intellectual Disability. Thank you very much.
You're welcome. Thank you for your time.